Hello, welcome everyone. Good evening. You're watching Dr. KK's Med Talks non-stop show. Welcome to Med Talks Live, Conversations That Matter, an education initiative supported by Eli Lilly. I'm Dr. Vishnu Vasudevan, and I'm your host for today's session. So, in today's world, many people are increasingly aware of the importance of maintaining a healthy lifestyle. However, when it comes to improving health, whether it is losing weight, becoming more physically active, or managing a medical condition, people often set goals that are too vague, overly ambitious, or difficult to sustain. As a result, initial motivation may fade quickly, leading to frustration and inconsistent progress. So, setting realistic and structured goals is therefore an important step towards achieving meaningful and lasting health outcomes. There is one widely used and practical approach, which is called the SMART model, which emphasizes goals that are specific, measurable, achievable, relevant, and time bound. So that's the acronym for SMART. So this framework helps transform broad intentions to maintain your health into clear, manageable actions, making it easier for individuals to stay motivated and track their progress. So let's start with today's session. We'll go to some obesity updates. So these are the key updates on obesity today. Obesity relapse or obesity coming back is highly common, with studies indicating that 80 to 95% of individuals who lose a significant amount of weight regain it within 3 or 5 years. Most individuals regain their own weight up to 50% of the last weight within 2 years, with many people returning back to the baseline weight. This is not because of their fault, but it's due to biological adaptations, something like a lower metabolism. Evidence suggests that slow and steady weight loss, approximating zero point 0.5 to 1 kg per week, is more likely to be sustained over time, compared with rapid weight loss programs, reinforcing the importance of achievable and time-bound goals. There is new research which shows that tailored generative AI in weight loss programs can significantly reduce weight and BMI, acting as a low-cost, scalable solution to the obesity crisis. Pilot studies now show that smartphone-based apps are available, which utilize mathematical models for dietary tracking and give personalized feedback from counselors, which can lead to about 9% weight loss within 12 weeks with high user satisfaction. Now let's go to the topic of the day. So as I mentioned earlier, we'll go to the topic of the day, which is how to set a realistic goal using this SMART model, which I mentioned earlier. Now let me introduce our guest for today. Is none other than Professor Dr. Nitin Kapoor. Dr. Nitin Kapoor is a consultant endocrinologist and bariatric physician, professor and head of Unit 1, Department of Endocrinology, Diabetes and Metabolism at Christian Medical College, Vellore. He is widely recognized for his extensive clinical and academic expertise in obesity, diabetes, metabolic disorders, with a particular focus on comprehensive management of obesity and related metabolic complications. Dr. Kapoor has been actively involved in clinical research, postgraduate teaching, and academic mentorship, contributing to the advancement of knowledge in endocrinology and metabolic medicine. He has authored numerous scientific publications, book chapters, and research papers in reputed national and international journals. And he is frequently invited to speak at scientific conferences and professional forums. His work continues to play an important role in strengthening evidence-based approaches to obesity, metabolic disease management, and he also promotes greater awareness about the importance of lifestyle and metabolic health. Welcome, Dr. Nitin Kapoor.
Thank you so much, Dr. Vishnu, for that very, very kind introduction. And it's a pleasure to be here, sharing the screen with you and looking forward to today's session.
Welcome, sir, once again. So first of all, I'll move to a small introduction about this topic, which is the heart of today's discussion. We all know someone, maybe even ourselves, who has said, from tomorrow I'll start dieting, I'll lose weight, I'll exercise daily. But what happens after a few days? Life gets busy, motivation drops, and slowly those plans disappear. So today we are going to talk something very practical and powerful. Not just losing weight, but how to set goals which actually and really work in real life. So, Professor Kapoor, let me start with a very simple and important question. We keep hearing about smart goals, but for someone who is sitting at their home, who is listening to our video, what does actually SMART stand for?
Thank you for that question. I think, as you had mentioned before, SMART has a specific acronym, but maybe what I would do is, from my practice, tell you some examples for each of those five letters that we're talking of. So S stands for being specific. So in my OPD, if I recollect, something specific as a goal that I would give to a patient when I say you have to do some walking or exercise. So I wouldn't try and put it like a time, but if I have a young person who says, Doctor, I like listening to songs, so I would say, okay, why not you walk till you listen to 10 of your favorite songs? So that would be a way of giving a specific, clear, how many songs they have to listen. They choose their favorite songs. They will probably enjoy doing the exercise, but it's a specific thing. It is 10 songs that I've put in the mind of my patient. It should be measurable. That's something very, very important. And nowadays, when we have so many apps, something like step count, a lot of people like to do. So M stands for measurable. So again, if I see that my patient is counting, steps, so this is a simple way of again measuring physical activity. I would say, okay, 6,000, 8,000, depending on what they're doing. I would give them a measurable count, like a step count. So that's it should be measurable. Third, it should be achievable. And again, a lot of people, as you said, build very high goals which they're not able to achieve. So again, picking an example from practice, I would say that when I look at my patient's dietary recall, which my dietitian would have done, and if that dietary recall is so many calories, say 1600 calories, if the patient understands how to calculate calories, I would say, okay, just reduce 500 calories from what you are eating in a day. You take the flexibility of how much and what you eat, but just make sure at the end of the day you do not exceed 500 calories deficit that we are setting as a target. So that would be achievable rather than bringing 1600 to 1200. Just reducing 500 calories may be achievable. It should be relevant. Again, one size does not fit all in obesity practice. If I have my patient coming to my OPD in a wheelchair, there's no point me talking about walking and doing, jogging and running. So it has to be relevant to that patient. So R stands for relevant. And last but not the least is time bound. I think that plays a very, very important role. Again, I've seen when I have, misses in my appointment schedule. So if somebody was supposed to see me at 3 months but missed my appointment and then comes back at 6 months, they often gain back the weight. So even a small touch point, in teleconsultation helps. So giving clear targets. Okay, I will see you in 3 months, and in 3 months, let us talk about how you've achieved your goal. So then the patient has that in the back of their mind, and they would, keep that target time bound. So S specific, M measurable, A achievable, R relevant, and T time bound.
Thank you, Professor Kapoor, for giving an elaborate description of and with specific examples also for this SMART acronym. So it can be used not only in obesity. I think it was initially introduced for other chronic manageable conditions like diabetes, if I am not wrong. But these are very important goals which we have to set for our patients, so that instead of making vague wishes, we are talking about some clear, structured plans which sound more practical. So we'll go for the next question. Professor Kapoor, why do you think so many people try to lose weight again and again but still struggle to succeed?
I think the key to this answer would be two words. One, when they set goals, they may not be achievable. And second is sustainability. So I think when we as doctors or when patients walk into our clinic, whatever targets we set, as you said, a lot of people fail again and again in their goals and targets and their weight loss journey. And the reason for that is that whatever targets they've kept are not achievable or not sustainable. So in our practice, we have to be patient centric. We have to understand what our patients can do and set only those achievable goals. We set something which we cannot achieve, it will be very disheartening at the end of the journey to see that we've not reached there. But more important is, I think, sustainability. So at times I have patients who would say, Doctor, so and so has lost so much weight on that specific diet. I want to try that diet. My question would be, will you be able to do that lifelong? If not, then that's not the right way, because you might lose a lot of weight when you follow that diet, but the day you would stop it, you would often get a rebound, and rebound would be much worse. So I think reason why people fail is because their goals are not achievable first place. Even if they're achievable, they're not sustainable sometimes. I think if you take care of these two words, we'll have a successful weight loss journey.
That's quite relatable. Many people actually put lot of effort into it, but still maybe it's the way we approach weight loss that is wrong, and that's why they are not able to achieve their goals. Going to the one important question, everyone wants quick results, but realistically, how much weight loss per month is actually healthy and sustainable for a patient?
Right. I think my answer has changed over the last few months. And if you would have asked me this question last year, I would have said, zero point 0.5 kg per week, about 2 kgs per month. I often talk about, 1 kg weight loss is achieved with 7,000 calories, which are lost. So if my patient is reducing 300 to 400 calorie per day, either by food or doing more exercise, they would approximately lose about 3,500 calories in a week, 7,000 calories in 2 weeks. So 1 kg will get lost in 2 weeks and 2 kgs in a month. But things have changed now with the advent of these newer, highly effective anti-obesity medications, which really help to lose a lot more weight than that weight loss, which is naturally lost over a period of time, is definitely much more sustainable than if those 20 kgs to be likely to gain back that much faster.
I'm sorry, there is some network issue. I think it's from the side of Dr. Kapoor. Let's wait for Dr. Kapoor to rejoin. Should I wait for Dr. Kapoor to continue? Come back? So actually, Dr. Kapoor was saying that why people are not able to lose weight as much as they want, and one thing was that, and second was how much of weight loss per month is actually healthy and sustainable. So previously he used to say that zero point 0.5 kg per week would be good enough, but with some recent changes he has now found that even higher amount of weight loss is possible and actually can be healthy also if done properly. So meanwhile,
Can you hear me?
okay, yeah, we can hear you, sir. Actually, we lost you in
Great,
between.
great.
You
Yeah.
were talking about weight loss per month, which is actually healthy
The
and
realistic
sustainable, and you were saying,
monthly loss.
yeah, monthly weight
So
loss.
I
Yeah.
think the
Can you please?
slower weight loss tends to stay on for longer duration, and the faster weight loss is a little hard to sustain. But nevertheless, the neuro anti-obesity medications are effective and if continued long, it helps in sustainability. But yes, on an average, without them, I would say about 2 kgs per month is a reasonable target, sustainable, and long-term effective.
Actually, nowadays social media gives so much of unrealistic expectations for people. People think that it's so there is some function coming on very soon, and they want to lose so much of weight in 2 months, 3 months. That's what they expect from, even from medications, or even without medications. They ask us how to lose so much of weight. So, what are the risks associated with losing too much of weight? And that's, I think people would be interested to know that also. If somebody loses maybe more than 5 kg per month, what would be the risk?
I completely agree. And first of all, I must say that yes, social media has a lot of people who talk about a lot of wrong things, but at the same time, we have people like yourself who really put the right message up there, and that is also very, very important. And thank you so much for doing all that work. A lot of time has gone in that, but yes, I think for all our viewers who joined us today, I would say that you can follow Dr. Vishnu if you really want the correct information about weight loss. But answering your specific question about how much damage can happen if you lose a lot of weight, and I would say in a short time, if you're not careful about your micronutrients, if you're not careful about your muscle strength, a sudden rapid weight loss without medical supervision can cause problems. Often I would have patients in my OPD who say, Doctor, I lost 15 kgs in the last 1 month, but now I feel my nails have become brittle. I've got hair fall. My memory is wearing off. So all of these symptoms can set in, which are essentially the micronutrients that are lost. So I think under medical supervision is the right way forward.
Thanks for highlighting that. A good expert who is well known about who actually takes care of you is a good addition to your. You need not do it alone. You should always consult a good bariatric physician to help you in weight loss. Thanks for highlighting that. Moving forward, should people focus only on weighing scale, or are there any other health improvements they should look for in addition to weight loss?
I think this is a very, very important question. So many times, not only the patients, but even physicians are focused on the weight. But I think the picture is much bigger. We have to look at, many other aspects like the quality of life of our patients, not only weight, but, other anthropometric measures like the waist circumference, the metabolic problems that are associated with obesity, like blood pressure, blood glucose values, all of them, how they are working. But most importantly, I would say to look at, the quality of life. How does my patient feel after the last visit to now? Are they able to do more activities more efficiently than previous time? Is their sleep better? So I think we should not be so weight centric. We should look at the bigger picture of improving the quality of life of our patients with the help of whatever anti-obesity measures that we are taking.
So even when the weight doesn't drop so quickly, your body might be improving, and you should focus more on your health rather than on the number on the scale. So thanks for highlighting that, Dr. Kapoor. Let's go to the next question. Many people is just an extension of the previous question. Many people feel discouraged after seeing that their weight has not changed much, even after putting in a lot of effort. So how else can they measure their progress? What are the other ways to measure progress?
Absolutely. And my first comment to all these patients when I see them is the first achievement is that you have not gained any weight. I think that itself is an achievement. Previously, when these patients are coming, they say every month my weight has been increased by so many kgs, so much has just increased over the years. So even prevention of weight gain, I would say, is an achievement. So that's point number one. But yes, I think beyond weight, we look at the waist circumference. In clinical sense, we look at, if your clothes, previous clothes are fitting you more comfortably, whether you've got improved stamina, and as I said before, whether your metabolic parameters like blood pressure, blood glucose, cholesterol, all of that is improving, whether you've got reduced joint pain, whether your mood has improved, whether your energy is getting better, your sleep is better. So all these points are also indirect measures of improvement of health, and they should be looked into.
So it's important that we, as doctors and physicians who are treating obesity, we tell them that there are other factors to other points to be looked into, just not looking at a number on their weighing scale. So if they're focusing more on their energy, most of my patients actually do much earlier. They get a improvement in their energy levels and sleep pattern, as you rightly pointed out. So those things have to be we have to reassure our patients that you are on the right track, and you'll find weight loss also after some time. Thank you, sir. Can you give our audience some real life examples of this specific, and you already mentioned actually this specific and measurable goals, but can you elaborate on that? Some real life examples of specific and measurable goals.
Right, like the one example I said about listening to 10 songs while doing walking or exercise. Other examples would be kind of having a measure like replacing all sugary drinks with unsweetened beverages, or having the walk at least 5 days a week. So I think they have to be very specific and measurable. But often I ask the patient themselves to come up with such solutions because they know best what is achievable for them. And if such specific parameters are coming from the patient side, then I know that they are going to be achievable. But specific, time points have to be put in. As I said, 10 songs for exercise, 5 days a week of exercise, or cutting down on this specific sugary drink. Or if my patient says I have 6 coffee per day with full sugar, then at least half teaspoon sugar, or then if no sugar if possible. So gradually reducing it is helpful. Some of my patients come from the eastern part of the country, and their sweet is a ritual, and if they don't eat the sweet after dinner, they would not really get to bed. So I would say rather than eating two sweets, maybe have one, or instead of one, have half. Or if it is kind of an Indian dessert, I would say follow the three-spoon principle, where you just take 3 spoons of it rather than finishing the whole big bowl. So I think giving such specific measurable goals is helpful. It somehow sticks to the mind of the person who's trying to lose weight and helps overall.
That's very clear. We should tell our patients simple, doable actions rather than big statements, big giving them making their life even more uh, troublesome, more than uh, as it is. So, how do we make sure our goals are actually achievable and not something we give up in a week?
Yeah, I think achievability is another very, very important aspect that should come into your discussion before writing your final prescription. And I think that depends a lot on my patient's current fitness level, the medical conditions that they have, what kind of daily routine they follow. And I'll give you an example. I had the patient the other day who, is very clear about understanding. She was a science student trying to, lose weight, but even though she knows everything what she has to eat, she's staying in a hostel and she's totally dependent on the mess food. So I can't say you stop your course and you go home and then you eat. She has to still live in those circumstances, but try and see what best she can achieve. So again, I think to make the goal achievable, we need to understand the current situation of the patient, the routine of the patient, the medical condition, level of fitness. But again, I think apart from that, making goals achievable can be realistic if you start taking smaller steps. Another example would be like, patient would say that dal and rice is a common dinner that is made every day in our home. So I could just say that, possibly increase the dal and reduce the rice rather than suggest some exotic diet to begin with, which they may do for a few days, but it would not be sustainable. But definitely the same food that is made, if the proportions have to be changed, is something which is achievable. The smaller steps are more realistic. Understanding the current situation of the patient, both medically as well as in terms of their routine, helps the goal to be much more achievable.
That's one very important point that Professor Kapoor has highlighted. Obesity, now we know that obesity is a disease, and just like we manage diabetes, where we look at the social determinants of health rather than the biology. We should look at the biology also, but specifically social determinants, like he mentioned, that the person might not be able to do something because of their own. If we tell them that you have to sleep for 6 hours, 7 hours, and they have a shift work, then it's not achievable, and we have to understand the social determinants of health also. Thank you, Professor Kapoor. So why it is important to give a time frame? The key of SMART was a time frame. Or, so why is it important to give a time frame for our goals?
I think that's very, very important. As I said before, if I have my patient who's missed a few appointments of mine, they always come back with weight gain. And even those patients who are from very far off, if they've just had a teleconsultation with me just for even 2 minutes, but then, they know that in 3 months, doctor will see me, I have to be responsible to that conversation that I have to have. I think giving that time frame is something very, very helpful. We tell the patient that in the next 3 months, let's focus on this thing. But if you don't tell that 3 months, and if you just say this is what you have to focus, it just dies out in all the 100 other things that all of us have to do in our life. So I think giving that time frame is the last word of the SMART, but it's the most important letter in the SMART framework. Time frame is important. It creates a sense of urgency, helps plan weekly goals, and overall, definitely, regular check-ins are definitely better than open-ended goals, which are easy to postpone or forget. All of us, when we put alarms, we just know the snooze button very well because we value that extra 5 minutes. And similarly in life, if our goals have that, snooze button, we just keep pressing it, and someday that goal just gets postponed or forgotten. So I think having a time frame is very, very important.
So without a time frame, it just becomes something we just keep postponing. So thank you. For next question, it's something related to our behavior or behavior science. Actually, we have been reading books like Atomic Habits. Small consistent goals can lead to big long-term results. So this is one thing which we have to highlight to our patients. Maybe they might think that how is this going to help me? I'm just changing a small part of my life. And uh, so what's your comment on that? Small consistent goals which can lead to big long-term results.
Absolutely. And I would use an analogy of, for all of us who've run a sprint or a race anytime, I would say weight loss journey is a marathon. It is not a sprint. If it's a sprint, then you can just quickly think of, 100 meters and somehow put all your might and finish it off fast and try and win it. But when you're doing a marathon, putting all your might for the first 100 meters and then being totally tired and left out for the remaining journey, it's not a good idea. So you go slow, you have your small goals, but you have to look at the long-term success as your main outcome. It really helps to build confidence. It helps to build motivation. Getting those small wins, promote further, kind of adherence to that protocol that you're following. And definitely, very, very rightly said, Dr. Vishnu, it is important to have your small goals achieved. Break your long journey into smaller halves. You'll definitely succeed in a better way.
So many people who uh, look for quick fixes, like actually medications also, they think of medications as a quick fix rather than a long term thing which they have to continue. Many people join weight loss programs thinking that paying some huge amount of money in 3 months they are going to lose weight, and they are not being told uh, that they are going to regain all that weight which they are going to lose so through that program. So it's not about quick fixes, but building habits, small habits which can you can maintain consistently. What should people do when their progress slows down or when they hit a plateau?
I think the first thing that I always tell them is that this is common. It is very, very human to be not keeping up with the pace because our human body is such. Medically, we talk about it as the set point theory. But yes, plateaus in a weight loss journey are common, and they are often to be reviewed. They shouldn't be abandoned. Your goals shouldn't be abandoned if it's getting a slow progress. We just need to adjust the time frame. We need to see what's not working right, try and discuss with your healthcare professional, meet your friendly neighborhood endocrinologist, and try and see, what they have to say in terms of their advice, why the plateau has happened, and how to, manage it. It's not something to be getting discouraged about. It is something which is common, and I think that's where your barrow buddy, your friend, as Dr. Vishnu had said before, you're not alone in this journey. You have help to take, and then make use of that. Make use of the expert advice that you can get.
So this is one stage when people actually lose hope, because then they feel that they have failed. And actually, when we counsel them earlier itself in the process, saying that it's actually part of the process and most of the people will hit a plateau, then they'll be they'll be expecting it, and they'll continue with their weight loss journey. Setbacks do happen to everyone. How can people stay motivated and get back on track?
Absolutely, and I think even our audience who's joined us, a lot of them are putting a lot of comments. And same question by Praveen Saheli, talking about setbacks and how we have to stick to the you know routines. Again, I think my message is lapses are common. We can expect it. We are all human. They are not a sign of failure, but this is something which is part of the game, and we have to know how to come out of it. And again, support systems, not only your friendly neighborhood endocrinologist, your family, your friend, your barrow buddy. On KK Med Talks, we do a barrow buddy show on every Wednesday evening, and that's all about this: who is your buddy and how they help you, take you through that journey. I think that's where setbacks are, can be managed. You can get back your confidence, your focus, and the lapses can be overcome.
So, as Professor Kapoor highlighted, that mindset shift is very important. We should know that this is always expected, and we should not be too hard on ourselves, thinking that we have failed, and we should not stop, just not quit, just continue. Now, it's a very interesting question, Dr. Kapoor. I think you're interested in this aspect of smart watches and apps. Do people actually get any help in their weight loss journey with using smart watches and apps? What's your opinion on that?
Right. So in my practice, I do get a lot of younger Gen Z people coming to me for weight loss, and I've learned a lot from them than what I have taught them. But what I would say is moderation is the key. I've had people who have been using these trackers, their health devices, and have become so over concerned of even some insignificant changes that their whole day is ruined just because their app told them that they didn't do well yesterday. Right. So I think they help. You can count your steps, know your heart rate, see your sleep pattern, kind of several graphs, apps, so much of information, so much of data comes out of it. Use it reasonably. Don't get over enthusiastic about it that your entire day you're just checking your watch about how many steps are over, rather than focusing on your work. In the 1 hour that you've spent, checked 100 times your watch about your steps, about your heart rate. Then it becomes a disorder. Don't become so obsessed about it. These are tools. These are evolving tools at this point in time. They are not 100% truth. Always, your watch may say you have a heart attack, but you may not. But they have to be used in moderation, and don't get over obsessed about it. Use them just for your benefit.
Thank you, Professor Kapoor. That's a very realistic answer. How about accountability? You were talking about buddies, and how is accountability helpful in checking our own progress? How will the buddy help, as you were just casually mentioning about that buddy program?
I think very, very important. Accountability is important. It may not always be to the doctor. It can be to your friend, it can be to your coach, it can be to your group, it can be to your psychologist, your barrow buddy, your parent, your spouse, your child, to whomsoever. But accountability makes a difference. Regular check-ins helps to maintain consistency. It helps to correct the course early, rather than waiting for 3 to 6 months. If within 2 weeks somebody at your home is telling, okay, you've not gone for a walk for the last 2 days, that will hit somewhere. That will, correct the path much earlier. And somebody else telling that may also be sometimes encouraging. It will make you choose your mindful choices. I'll give you an example. My wife and myself, we often think of having a good diet, but then if one of us defaults, then the other one would correct. And I think that's something that really helps. So having that barrow buddy, and I'm again saying it need not be doctor, it need not be your coach, it could be your family, your friends, anybody. It helps.
So, as Professor Kapoor said, if you are lucky enough to have a good spouse who uh, has got the same wavelength as you, then they might also be helpful in uh, maintaining that accountability. I have my fitness trainer. I'm least accountable to my wife, though my wife constantly keep on asking me that you have to go to hit the gym, but I'm more accountable to my fitness trainer than her.
I would have a disclaimer here. My wife is a nutritionist, so that can be sometimes a bit counterproductive, but yeah, part of living. I hope she's not listening though.
So I think we have covered most of the questions. I'll go to the final question then. What is the common mistake which you find when people set their health goals, especially regarding obesity?
Right. I think the common mistakes are at times the goals are over ambitious. They may be vague. They may not have clear plan. Somebody in the OPD says, "Doctor, I want to lose 20 kgs in the next 2 months." I know that's not the right way. That's not right. So that's one common mistake. I think focusing on just the number of the scale, and this is not only the patients, but even sometimes some doctors, they just focused on the numbers. I think we have to move away from that, look at obesity as a bigger picture, look at behavior, look at health outcomes in a bigger picture, and move away from just looking at the weight. Also, another problem I feel is sometimes some patients are trying to change too many things at the same time, and then they're not prioritizing what is right and what is wrong, and few major things that they should get left behind, but some others don't. So I think these are some of the common mistakes that often people make while considering goals. And I do see so many questions in the chat box. Maybe we could
Yeah,
take
I
a
think
few
we'll
of
have
them.
to. Shall we take some questions then, sir? We have
Definitely,
around 15 to 20 minutes left. There are so
sure.
many questions. It's a very important topic. So
And we've got such a
people will be
handsome doctor
interested, and there will
asking
be something
questions.
we have not talked about medications as such, and people will be interested to know about medications, I think. So one question interesting is weight loss possible with diet alone? I don't have time to join a gym. That's a very good question
All
by
right.
Ruchika Sharma.
Sure. So as I said, for losing 1 kg, you have to have a deficit of 7,000 calories. Now, it's actually much easier to lose 7,000 calories with diet than for exercise. And, and Dr. Vishnu may correct me if I'm wrong, but if I ask somebody to go to a gym, maybe run on a treadmill, maybe on a slope for maybe 30 minutes, 1 hour, how many calories would you burn at best? Dr. Vishnu, any guess? What would you say from your
We'd be burning
experience?
around 200 calories or 250
200
calories at the
calories. So
max.
that would
Yeah.
come in 1 cup of coffee with sugar, one cappuccino maybe,
Yeah.
and that's all that you've burned. So I
Yeah.
think losing weight with diet is easier than with exercise. I'm not saying exercise is not important. Exercise really helps in weight maintenance, helps in your muscle strength building, but only diet will help you lose more weight. So again, sustainability is important. If you cannot do exercise, see what you can do in your daily activity. Sometimes you can, if you're a doctor, you can stand and do your OPD rather than sitting. You can have these short 5-minute breaks that you can take. Whatever little you can do, but yes, diet plays a very, very important role in weight loss, because that's where you can cut down calories. If you're taking 2,000 calories and if you reduce 500 calories, again, in 2 weeks, you'll be off 1 kg, but that may not happen with exercise.
So as Dr. Kapoor already mentioned, just doing exercise and thinking that your exercise is going to burn off all the calories which you eat is uh, definitely not possible. I counsel them that one idli you take extra, you will have to run for 5 kilometers or 10 kilometers to burn off that one idli. So uh, you cannot what do you say outrun your diet, and you will definitely have to uh, for weight loss, as you rightly pointed out, weight loss diet is more important, and for weight maintenance, exercise comes into picture and to prevent your muscle loss and sarcopenia. So some people have mentioned Ozempic. Yeah, they have mentioned the trade name of uh, semaglutide. Is it safe to take semaglutide for weight loss?
I think it's the answer is different for different patients. You need to consult your friendly neighborhood endocrinologist. For all of those who are from Kerala state, can go to Dr. Vishnu and knock his doors, and he will guide you whether it's right for you or not. But don't try and decide that based on online, apps or people, friends. I think you need to see a medical professional. These are not medicines that are taken for 1 week or 1 month or 1 year. They are long-term medicines. We need to be sure that you're taking them right, your dose is correct, the escalation of dose is correct, and we are monitoring you very well during these medicines. These medicines are spectacular, but to be used only under medical supervision.
So let's go to the next question. I think you'll be interested in answering the question. I don't know how it is directly relevant to our talk, but can you talk about how to take care of bone health? Maybe they are asking about, it's a extension of weight loss journey. You are going to lose muscle, and in turn, bone loss also can happen.
Right. Thank you, Anshu Manchanda ji, for that question. But if you're talking of bone health, I think three or four principles that come to my mind immediately is to make sure that you have the adequate amount of calcium and vitamin D that you have to. And if you're a 50 plus postmenopausal lady, the amount of calcium that you need to take is about 1,200 milligrams per day. That comes with 1.2 liters of milk and milk products. And I'm sure many of us cannot take that much of milk. So, again, consulting your doctor, making sure you get a calcium supplement if your diet is not adequate is important. Making sure you are taking the replacement doses of vitamin D, because most of us are not exposed to sunlight the amount that we should. And despite a country like India where we have so much of sunlight, maybe it's our dark skin color, maybe whatever reason, our vitamin D levels are definitely very much lower. But yes, if you have osteoporosis, if you are eligible for being screened for poor bone health, then you should see a doctor, because they are very effective, very, very good medicines that can prevent a fracture if you have poor bone health. So, again, seeing a friendly neighborhood endocrinologist would be a good answer to your question.
I think a major concern for elderly obese patients would be bone loss, and maybe that too would be an interesting aspect. I'm worried about bone loss for my patients after the age of 65 and all. That's one. Sometimes that age group of patients might also come for medications for their weight loss, and too much of weight loss can be detrimental for their bone health. Uh, how can I set small goals? Saheli Parveen has asked. We have discussed that in detail. Would you like to answer that question, sir? How do I set
Right. I
small
think,
goals?
yeah, we did talk about it a little bit, but
Yeah.
then again, I would say ki, small goals are important. You first start with something that you can do in a day, something that you can achieve in a week, and then you talk of what you can do in 1 month and 3 months. I think the best person to tell which goals you can start small is you yourself, and that's what I've seen in my experience also many times. Patients come up with spectacular answers rather than me setting small goals for them. But you can take a paper and pen and think what are the health related goals that you can set for maybe a week, a day. Examples could be, again, being regular with walking, changing your proportions in diet, avoiding certain items, reducing for certain items, but you can decide what is the best for you.
Thank you, sir. And somebody has written Ramji Agarwal ji कि 6000 कदम चलने पे मेरी 200 कैलोरी खर्च होती है. एग्जैक्टली, दैट्स व्हाट वी आर सेइंग.
एंड 200
6000
कैलोरी
कदम
आपकी
पे चलने
चाय
पे
में आ
इतने.
जाएगी। तो राम जी
हाँ
अग्रवाल
जी.
जी, तो चाय को बिना चीनी कर दीजिए, तो फिर वो 200 कैलोरी, 100 कैलोरी आपके शरीर के लिए अच्छी रहेगी।
और कंटिन्यूसली एक दिन में हाफ एन आवर और 1 आवर एक्सरसाइज करने से अच्छा है. या उसके साथ साथ आपको ये भी करना है कि आप डेली लाइफ में थोड़ा चेंज बदलाव मैंने एक्चुअली किया है. आई हैव मेड माय OPD stand at a higher stand so that I have to stand up every time after seeing the patient to type in, because we are all OPD doctors, mostly endocrinologists. So we have to sit for long. If your profession is also something like that, then I would advise that you make some changes in your daily life so that you can incorporate some sort of small exercises in your daily life too. मैं चीनी बिल्कुल नहीं खाता. थैंक यू राम जी अग्रवाल जी. So we have completed all the questions. I think it's time to close the session. So that was very insightful and practical discussion on the smart guidelines or smart technique to lose weight and maintain that weight loss. We have it's very important nowadays because our central drug control organization has also highlighted this issue that medications are not to be advertised in any way. Medications are not the uh, ultimate goal, and in India at least it's uh, illegal and unethical to promote medications as a sole way to tackle obesity. The lifestyle has to be always kept at a higher stand, and we have to uh, continue our lifestyle changes, meet your health professional who is available to you, and always incorporate weight. If at all you're eligible for a medication for weight loss, you should always do it along with lifestyle changes. So thank you, Professor Kapoor. It was an excellent presentation and I enjoyed it so much. I think we can call it a day. So thank you, listeners, for joining us today, and we'll be coming back with the next episode of KK's Med Talks. Thank you and
And
good
a
evening all.
thank you, Dr. Vishnu. You were an excellent host. It was a pleasure being with you. Look forward to having more sessions with you. It's been great. Thank you.
Thank you, sir. Thank you. Good night all.